Hi, I'm Scott Baver, and I am the head of medical affairs at ITF Therapeutics. And ITF Therapeutics is a company based out of the Boston area that focuses on rare disease. And currently, we are in commercialization with Givinostat or Duvyzat and Duchenne Muscular Dystrophies in boys who are 6 years of age and older. So the Duchenne muscular dystrophy space with respect to the treatment landscape has really changed dramatically over the course of the last decade. Prior to the newer therapies, including dystrophin replacement therapies and Givinostat, boys living with Duchenne were treated, their standard of care was with steroids. Over the last decade, there's been impressive gains made on the treatment landscape with respect to treatment paradigm. Thinking about gene therapies, exon skippers, and now Givinostat, and thinking about future research and potential for boys living with the disease. The ultimate goal is to prolong life as well as reduce disease progression. And we've seen, again, a dramatic change over the last decade in Duchenne muscular dystrophy. Givinostat is a histone deacetylase inhibitor. And while the exact mechanism of how Givinostat works in Duchenne muscular dystrophy is unknown, what we know from preclinical research and clinical trials is that Givinostat, which is the HDAC inhibitor, reduces inflammation, it reduces scarring, it reduces fatty tissue deposit, and it potentially increases muscle regeneration. And all of these mechanisms, the goal really is to reduce decline in function based on muscle deterioration. So, what we think happens is reducing this muscle deterioration ultimately results in improvements in outcomes. And what we've seen from our phase 3 pivotal trial, the EPIDUS study, there is a difference when individuals are treated with Givinostat plus steroids versus steroids alone. We see this in our primary efficacy outcome of the 4-stair climb, where this difference is 1.78 seconds slower decline in individuals receiving Givinostat plus standard of care compared to just standard of care, which is corticosteroids. So we recently presented 4 posters at the Neuromuscular Study Group, and our data that we presented were focused on our EPIDUS clinical trial, and they were post hoc analyses done as well as more of an investigation into our safety profile. So one important poster that we presented was the efficacy based on our final dose. So the EPIDUS clinical trial, individuals were randomized to either Givinostat or to placebo, and their dosing was weight-based. Furthermore, if an individual had an adverse event, such as a reduction in platelets, diarrhea, or an increase in triglycerides, they were able to reduce their dose throughout the course of the study. One key question that we receive and that we ask is the dose of Givinostat effective as you reduce your dose? And so in a post hoc analysis, we analyzed the results of the key primary outcome result of 4-stair climb, as well as North Star ambulatory assessment, to determine if individuals had a clinical benefit based on the highest dose or reduced doses. In addition, we presented data on the role of Givinostat in the reduction of platelets. So we know that from our EPIDUS clinical trial that 33% of patients that received Givinostat had thrombocytopenia, whereas no patients in the placebo group demonstrated thrombocytopenia. We wanted to understand more of a mechanistic role of Givinostat with respect to thrombocytopenia and more details around these particular events. A final analysis that we did in our final presentation was looking at the correlation of fat fraction to clinical outcomes. And we determined what the level of correlation was between fat fraction, which we know is reduced following Givinostat, and the improvements that we see in the clinical outcomes, such as North Star ambulatory assessment and 4-stair climb. So Givinostat has been approved as Duvyzat since March of last year, and has been in the US we've just had our 1 year anniversary. We have current ongoing clinical studies that are being conducted in Europe for boys who are non-ambulant, as well as an under 6-year-old study with boys receiving Givinostat. And finally, in the US, we have an open label observational study, which is called Providus, and has just started enrolling individuals who are receiving Duvyzat to look at the real world experience of Givinostat. For us at ITF Therapeutics, what we're hoping is that getting these data to clinicians and to the community can help inform decision-making processes. When I think about the open label observational study or Providus, our goal is really to understand what is happening in the real world with respect to Duchenne treatments overall. So these data can provide the entire community an understanding of the role of Givinostat in Duchenne, so they can make their best treatment decisions. For me, getting these data out to the community are really critical. Understanding what the needs are for the community is also important. So as a medical team here at ITF Therapeutics, we're here to really understand what are those needs so we can help create data and communicate data with the community together.